gonna. There you go. You're rolling now.
We're on?
Yep, we're on.
Alex, we're good?
I'm not very good.
He might not know for a few seconds.
Yeah, it can be up to 30 seconds.
So we're here. We hope we're live. We're going to get the thumbs up in a second. Jasmine's here. She's going to handle your questions. Thank you for submitting some questions before. And so we're just going to try and answer some. Alex is also here. Alex is going to be our subject if you have any questions just about some injuries or what we can do. So Jasmine, what's the first question?
The first one is, how might one avoid muscle spasms and cramps, and how do you determine if it's due to a mineral deficiency?
Okay, so muscle spasms and cramps. Very important question. Let's deal with cramps in general. It's a hotly debated topic in this, and Martin Schwellnus out of South Africa has done a lot of work. And there seem to be two different types of cramps, and talk about the mineral deficiency. So cramps seem to occur when the muscle is fatigued, is exhausted. That's when they're going to occur in general related to sports. So you can think of tennis players who are playing, and it's not at the beginning of the match that they get a spasm or a cramp. It's somewhere near the middle or the end, and it's usually more if they're hot or not. There have been some studies in which people regularly got cramps, and they would take some salt tablets, and that would help prevent the cramps. They're not well designed, and Dr. Schwellnus has important concerns that most of us share about those. But they are impressive nonetheless, that if you take somebody who's always getting cramps, and then every time they take particular salt tablets, they don't get cramps, and then they stop taking the salt tablets and they do get cramps, that is very good evidence that there's a causal relationship between the two in that one person. We're not talking about in cramps in general, and we don't know how often that occurs. The other part about cramps, if you think about marathon runners or long-term endurance events, is that people don't get cramps in one muscle per se. They're getting it more diffusely through their body. But there is not completely through their body. So if it was that you were lacking minerals or salt in your body, all my muscles should be cramping up. But that's not what occurs. It's only the muscles that I was using. So it's this combination or interaction between the two that seems to be there, and we're just not quite sure. The best way to prevent cramps is to be in shape and not to get overly fatigued. The muscle will cramp when it's in a shortened position. And so what we do is we try and stretch out the muscle as a treatment. That's the first important treatment. Alex, are we still synced? Not completely.
It's a little bit off, but not terribly bad.
Okay.
Why?
So I apologize for the technical difficulties. We actually ran some tests last week, and it was perfect. It was beautiful. We ran 3 or 4 tests over about a half hour, but here we are. So anyway, I hope that answers about cramps. Mineral, you can try that. People talk about pickle juice, or look, the best thing you can do for yourself if you really want to try it, just do a set amount of exercise that usually provokes your cramps, then try the same set taking pickle juice or whatever it is that you want to do, and then do it again without, and then with. Maybe it's bananas. Some people talk about bananas. Whatever it is, and see if it works for you. In general, when people look at it, it does not seem to help very many people in the studies that were done. Jasmine, what else do we have?
It seems that the general timeline for activity, like the FIT principle, is on a week-to-week basis. Does the body actually work on a 7-day cycle, or is it is the choice of timeline somewhat arbitrary?
Now, the body works exactly on a 7-day cycle. And on leap years, it's 7 days and 1. Completely arbitrary. All of these timelines, and these are rules of thumb that we try and give to people so that they can think about it at a conceptual level. What's important is the reason the 7 days is used to give you incorporate the concept of recovery time. If we use 1 day, you exercise so many hours, so many minutes on 1 day at such intensity, we're not incorporating the recovery time. So we could talk about 2 days. But the problem is that people don't exercise every day. So they might exercise 2 or 3 times. So if we look at it on a weekly basis, then that kind of makes sense. Now, at elite levels, they will talk on much larger scale. So they will have macrocycles and microcycles. And so they might train, let's say, from a whole season, they might have the training starting in September, finishing in March, and they might have a session, let's say, going September, October, and then they change the training for November and December and January and February. But then within September, October, there are also cycles. And that's getting into much higher level training where you're really training for performance. In this course, we're trying to deal with it on a more conceptual level so that you can get out there and be active, maybe do a little bit better than you've done in the past. But if you really want to compete, you're going to have to get people who know more than I do.
I'm just going to add to that, actually, because you spoke a bit about recovery time. Somebody asked how much time is enough time for recovery after exercise, specifically when the muscles are sore for the next few days?
So how much time is enough time? Certainly, if your muscles are still sore, then that's not enough recovery time. Let's say as a general rule. Nothing's absolute. It's like not 7 days, nothing's 100%. But in general, if your muscles ache, it's because they are releasing chemicals that are stimulating the pain fibers that are sitting around there. And that's not a normal process. The higher intensity of the activity that you do, the more recovery your body needs because the more damage you're doing. So we generally talk about, look, if you're just walking, you can walk every day. And if you're lifting very light weights, you could do that every day. The heavier weights that you lift, the more rest you need. So if I was lifting very heavy weights, I might take 2 days rest in between those training. You'd say, but that's crazy. People who are doing Olympic weightlifting and they're training every day or 6 days a week. True. But they don't train the same muscles every day. So they'll train their legs 2 or 3 times a week. They don't train their legs 3 times a week, 7 days a week. So that's just in terms of as a general. Now, what is high intensity? Well, that depends on how fit you are. So for me, if I was to be bench pressing right now 150 pounds, I don't know if I could bench press. I should be able to bench press 150, but let's say I can't. I doubt I can. That would be high intensity exercise. For somebody who's working out regularly, who's normally lifting 200 pounds, then 150 pounds is light exercise for them. And they don't need as much recovery time. So it always goes in relation to what your level of fitness is, what your body is used to, and that sort of relative intensity. Jasmine?
Yeah.
Frank's doing some tests with us, is trying to get the syncing to be a little bit better than it is.
I'm just going to follow that one up with what are the benefits or effectiveness of high intensity interval training?
So there are we've talked about different types of training. You can go walking, you can weight lift, and so you can do endurance training with weights by using light weights and doing one set of 30 and doing it rapidly and never stopping. Sort of certain types of gyms run that way. And then there's high intensity, where you're really working at a near maximal level or closer to maximal level. So we might say greater than 85% of your max would definitely be high intensity training. Those cutoffs, again, are arbitrary. So if I'm working at greater than 85% of my maximum, and that could be if I'm lifting weights and my maximum is 150 pounds, it would be greater than 85% of 150, which is, I don't know what greater than, what is that? That is, oh, I don't know. 85, 130, let's say. If I was lifting more than 130 pounds, that would be high intensity, whereas if I'm lifting 40 pounds, that would be low intensity. If I'm running, and I normally run at a pace of 6 minutes per kilometer, which is not that fast. Then if my maximum was I could run a kilometer in 4 minutes, 6 minutes might be upper high intensity. That's only about 70%. But you get the idea that it's always related to your maximum. Now I forgot the question.
Benefits and effectiveness of
Benefits and effectiveness. So if you're trying to gain strength, then, and you want to do it in the shortest possible time, then you want to work at a higher intensity. That will allow your muscles to get stronger faster. The problem is that the higher the weight you lift, the more the risk of injury. So it's this trade-off of how much do I want to get stronger, how much faster, and maybe I'll work at a lower intensity and I'll be okay. In running or endurance sports, it's similar in that the faster I run, the more stress I'm putting on my body, the more likely I'm going to get injured. There's a little bit difference in that when you're running slow, you're breaking down glycogen. We went through this in the previous lessons. Breaking down glycogen at a slow rate. And so you're not asking your body to break it down at a faster rate. And then you go to a race and you want to break down the glycogen faster, but you can't because your body hasn't been adapted to that. So what do you want to do? You want to train faster to be able to train your body to break down the glycogen faster, and therefore in the race you'll be able to break down the glycogen faster. You'll also be able to, remember the lactate buildup? Well, if we can get those enzymes and get our body revved up so it can produce the enzymes more rapidly, we'll never produce the lactate. We will just use up that breakdown products of glycogen more rapidly. We will be able to use oxygen more rapidly. And so our lactate threshold, if you remember, it increases, one, because our VO2 max increases, but also because it increases as a percentage of the VO2 max. And high intensity training allows you to do that better. There's also some evidence that high intensity training increases your VO2 max better than low endurance training. I'm not up to date in that. That was a number of years ago. People were looking at these different mechanisms. It all makes sense. And again, you have to enjoy it. So if you don't enjoy high intensity training, then it's not for you. If you are interested in performance and willing to take the extra risk, then there are certain benefits to the high intensity training. The other part is, just as Steve Blair was talking about, walking. You walk, we want to take walk a half hour a day or an hour a day. If you run, you get the same benefit in less time. So if you had less time pressure, you had time pressure and you had less time to do things, you might do your exercise at a higher intensity, get the same benefit as doing lower intensity over a longer period of time.
The next one is about injury. So is it possible to become 100% healed after an injury? A student gave an example how he or she both sprained their both ankles and at different times in their life, and they have never really ended up back at the place they started.
This is a great question, and it's again hotly debated, and it happens to be one of my fields of research. So what do we mean by heal 100%? What we do know from studies, and there are a lot of sport medicine physicians and physiotherapists and other clinicians who believe you never heal to 100% because they read studies that show the biggest risk factor for an injury is having a previous injury. We don't have time to get into it here, but those analyses are all flawed. And just in brief, the reason they're flawed is because even if you did heal to 100%, the way they analyze the data would still show an increased risk of injury. Now, if we think about healing, if I just scrape myself on my hand, I see a mark, maybe I draw blood, and then that heals, and I look at the skin, and it looks fine. I mean, I've cut my hand before, and I don't see anything. So, well, maybe that's healed 100%. But that's just the superficial layer. Deep, there may be a little bit of scar tissue. I don't know if you can see, you won't be able to see this. Right, let's see, maybe here. I'm trying to show you a scar. You can't really see that here. But I was 13 and put a penknife through my wrist. So I got a scar there. Now is that healed 100%? Well, it's definitely not the original normal tissue. I think when we mean, did we heal 100% is, have we returned to the same risk of injury as we would have had we never been injured before? And I personally believe that that is possible. We published a paper in Cirque du Soleil Artists in 2011 showing, maybe we should put that paper up after this, showing that the original way, showing the analysis that everybody else does, shows that we would think that the Cirque du Soleil Artists did not heal 100%. But when we do the proper analysis, or one of the proper analyses, because there's several different ways, that they did return to their pre-injury risk. And so in this course, we're going to get more into detail about rehabilitation and how to actually get yourself back to that 100% level, to restore your strength, your range of motion, and your balance are the three key features. But there's a whole host. So I believe it's possible for most people. Sometimes and in certain conditions, it's definitely not. If you tear your anterior cruciate ligament, that will not heal. You will be at risk for long-term problems, both related to your knee and the osteoarthritis of your knee, and also to the knee giving way. And even if you get it operated on, you don't get back to 100%. But for if you get a tendonitis or a muscle strain, I believe you can get back to 100% with the proper rehab. We get any new ones? No?
A few.
Oh, okay, you're getting them too? Excellent, excellent. I should have paid more attention. Well, only if we're working through according to you. Yep. Actually. You got the helm.
So we could get a new one. You mentioned the benefits of a regular stretching routine. What qualifies as regular? They asked 10 minutes a day, 3 longer sessions a week. What type of stretching is the best, static or dynamic?
Okay, super great questions. First of all, in the last screenside chat, you saw me trying to start stretching. Boy, that was sad how inflexible I was. But I've been stretching every day, and in the next screenside chat, I we'll see how much I benefited. I've been doing just static stretching. There are many different ways of stretching. Somebody in the discussion group, and I commented on it, called it PIR. I can't remember what the acronym was, but it's another term for what we call proprioneural stretching, or PNF stretching. The PIR is one type of it.
Post-isometric relaxation.
Post-isometric relaxation. Alex corrected me. So I can show you something very quick here. Jasmine, do you want to do so let's just see this. Okay, so what this is Jasmine, turn your head all the way there. So that's how far she can get. Comfortable? You're good? Okay, now just push against my hand. Turn your head the other way. We're just going to hold that. 1, 2, 3, 4, 6, 7, 8, 10. And now look over again. Nope, the other way. And she goes a couple degrees further. Okay, very, very effective. PNF stretching is the most effective way to stretch if you want to gain an immediate increase in range of motion. Over the long term, say over weeks or months, whether you did PNF or static or dynamic stretching, we're going to come to what dynamic stretching is in a second, it really doesn't seem to make much of a difference. What's important is that you bring your body to the end range of motion and a little bit past in order to try to establish a stimulus for your body to know that you want to go further. And when we do stretch over a long period of time, you'd think it's getting easier to stretch. But in the lesson, I explained, it doesn't. The reason you can go further in your range of motion over weeks is not because the muscle is easier to stretch, but because you don't feel the pain anymore. Now, if you don't feel the pain anymore and you get stronger, it's because something is changing in the muscle itself. Now, that's different than what I just did with Jasmine. So what I just did with Jasmine has two effects. One, the muscle does get easier to stretch. So as I'm stretching, the muscle sort of expands, viscoelastic behavior. So expands isn't the right word, but it gets easier to stretch over the short term, and that makes you able to get more range of motion. Plus, you're masking the pain over the short term. Over the long term, it's all about not feeling the pain, but it's not the same because you can actually get a change in the structure of the muscle. And we see that in the studies that I showed you. The muscles actually get stronger. They get thicker. And we actually have broken down into the mechanisms, and we know some of the mechanisms by which that occurs. Now, what's dynamic stretching? So one of my pet peeves. When people describe in their studies what they said, what they mean by dynamic stretching, it is identical to what we have always called warm-up. It is moving your muscles through a normal range of motion through activity. So this is dynamic stretching. But I'm not going to my end range of motion here. I'm just going like, okay, I just kind of feel it. I am not going and stretching the way you would think you have an elastic. So I'm going to use this model of the knee. But here we have just a material. And if I just pull it out and I try and pull it apart, that's trying to stretch the material. If I'm just tugging on it lightly, I'm not stretching the material. So what do we mean by stretching? Dynamic stretching, the warm-up and going through the full range of motion, is not an effective way to increase range of motion. So if you want to increase range of motion, PNF stretching is the best whenever they study them head-to-head. Dynamic movements, I'm not going to use the term stretching. Dynamic movements by themselves do not increase range of motion very well. If you combine them by moving them into the full range of motion, well, now you're warming up and you're doing what we used to call ballistic stretching. But people used to downgrade ballistic stretching because as you stretch into that motion and then relax, your muscles contract. The next time you go into that motion, you're doing it against the contracted muscle. And there were a number of people who would do this vigorously and would get injured. And so because of that, we stopped telling people to do ballistic stretching because we were worried about people doing it improperly. And then there were movements to do stretching where you go to the extreme and then you just kind of do micro movements at the extreme. Well, now you're not going to get injured at that point. So that was one form of stretching. So these are all just slightly different forms. Again, over the long term, if your goal is to increase range of motion, it really doesn't seem to matter whether you're doing static or PNF stretching, and I'm going to stick to those two. You should do a warm-up before you do those. You want to say you do dynamic stretching and then PNF, or dynamic stretching and then static stretching? Okay, I don't know why you want to use the term stretching for that movement. It's movement. Static stretching, PNF on the long term doesn't matter. There are mechanisms which we've talked about, and I commented in the blog, in the discussion group, that are different. Now, that's one objective, is range of motion. But that's not everybody's objective. What if your objective is injury? But I want to increase range of motion because I want to reduce injury. Well, that might be true, but sometimes you want to increase range of motion and it has nothing to do with injury. So somebody wrote in the discussion group that all their courses in ballet and dance were about stretching. And I think we have another one of my articles up where I talk about why it's important to stretch for performance. So in a ballerina, they have to hold a certain position. And if they stretch, they can hold that position longer. They might not be able to jump as high. Let's say they jump 20, they have a vertical jump of 20 inches, or say, let's be high. Let's say 20 inches, which is what, 45 centimeters or something. 45 centimeters if they don't stretch. And if they do stretch, they can jump 43 centimeters. If you're in the audience, you're not going to notice that difference in height. But you will notice if they can maintain that position for an extra half second. So we have to distinguish between tests of performance, which is what we do in the research labs, and performance, which is on the field. If you are talking about sprinting, you will not run as fast. Our test of performance is the same as the performance. But if you're talking about martial arts and you need to kick somebody in the face, you have to get your leg up to that face, right? If my force is reduced from 100 pounds of force to 95 pounds of force, but I hit your face, that's much more effective than if I kick with 100 pounds of force and miss you. So again, tests of performance are force and speed and things of that sort. Performance in many activities is much more complex, and their range of motion may be more important or adds to the ability to perform above and beyond what we're testing in the lab. So we have to define the outcomes. From a perspective of injury, Stretching, if you exercise every day and stretch every day, you're not going to prevent injury if you, if you stretch just before your exercise. But if you stretch outside your periods of exercise, it does appear that you would prevent injury. Whether you stretch after is beneficial, nobody's done that study really. I think it would. So I tell people to stretch after. Did I miss one part of that question? I think.
You actually ended up answering my second question.
Oh, okay.
Stretching after exercise.
How long? One day? What qualifies as regular? As regular stretching? Well, you can test this yourself. If you stretch once a week, my guess is you'll find that you don't increase your range of motion. If you stretch every day, you will. Now, if you stretch 2 days a week or 3 days a week, everybody's going to be a little bit different. As opposed to other types of exercise, stretching does cause a little damage. All exercise causes a little damage, and stretching causes a little damage, but you will recover over the next day, in fact, even faster than that. So you can stretch twice a day. If you're lifting weights, you need to give yourself a day rest in between. Heavier weights, you need to give yourself more rest in between. In general, what we talk about is training once a week doesn't produce benefit. Training twice a week will produce benefit if you're really out of shape. But really, to gain a benefit 3 times a week or more, to maintain twice a week. It's a rule of thumb. The body doesn't work on a 7-day cycle. All of those things that we said at the beginning of this hangout. It's really, you can test it yourself and see if you are stretching and not achieving benefit. You might be not stretching often enough. You might be stretching incorrectly in the sense that you're forcing yourself and doing too much damage. So that, because if you do damage, the muscle's going to tighten up afterwards. You might not be pushing it hard enough. So you're feeling some tension in your skin, but you're not actually creating the stimulus you need to actually get that stretching benefit. So you always think about it. When you're training, you should have goals, and you should be on a path over time achieving those goals. And if you're not, you should change your training or change your goals.
So we'll switch gears a little bit now and talk about the Achilles tendon. If that's okay with you. What are the most common causes of irritation, swelling, and pain in the Achilles tendon while jogging, and what can be done to prevent and treat pain and swelling in the tendon? Are there specific training or warm-up that would be best for it? Okay, so I'm going to ask Alex to come. We're going to do a little demonstration. I want to make sure everybody understands what the Achilles tendon is and where it is. Okay, let's move that over. Okay, you need the socks off too. Okay, both? No, it's just one. Yeah, okay. So how are we going to do this here? We'll just tilt this down there. Okay, that's good. Okay. So here's Alex's foot, and the Achilles tendon is this cord in the back here of the ankle, okay? And the Achilles tendon is the part of the muscle, of your calf muscle up here, that comes down and attaches to your heel. And so when this muscle contracts, what it's going to do is going to pull the heel up, so go up on your toes. There you go. Oh, look at that. Okay, perfect. And then when it relaxes, these 2 points will become further apart. And then up, they get closer, and then down they relax, they get further apart. So that's the Achilles tendon. Now, like any injury, it occurs when you put more stress on it than it can absorb. Now, how are you stressing it? Again, from Alex, it's this your calf muscle, which makes you go up on your toes. So go up on your toe and down. So that's the stress. Anything you do that forces you into that motion is stressing your Achilles. If you do too much, it's going to make it worse. So now let's think about,
we have a container here? Let's see here. Now I'm going to do something to Alex here. Well, no, we're still on his foot. Still on his foot. Let's say Alex was hiking uphill. This would be the hill. And look at the extra position. His Achilles is now stretched, and he has to generate force when the Achilles is stretched. So going uphill puts a lot more stress on the Achilles tendon. So if you were somebody who liked to go for walks and you were having Achilles tendonitis, but you didn't want to give up your walks, you would walk on the flat, and you'd be able to maybe maintain your walks for much longer before you would have pain. Okay, can you repeat the question again?
What are the most common causes of irritation and swelling in the Achilles when jogging, and what can be done to prevent or treat the pain and swelling?
Okay, so let's go back to Alex. We talked about being up on your toes, calf muscle. Alex, I want you to just jog on the spot now. Now, notice when Alex is jogging on the spot that he's landing on his toes. Try jogging on the spot, landing on your heels.
Can't do that.
Can't do that. Right. So when you are in aerobics class or step class or things, and they have you jogging on the spot, you are putting a lot of stress on your Achilles. When we run, now I don't know what kind of, Alex may be a toe runner, so people who sprint,
I'm a toe runner.
He's a toe runner. So Alex is going to run on his toes. Other people run and they land on the midfoot, and other people run with heel strike. So there are different ways of running. People who are toe runners are putting a lot more stress on their Achilles. I think that's good. We're going to want Alex to, we're going to need you back in a few minutes. But so people who are toe runners are just putting a lot more stress on their Achilles. As long as they don't overstress themselves, they don't do sudden increases, and they've gradually built up to it, and their Achilles can probably withstand the stress that they're putting on, and they're not going to get injured. And somebody who's a heel strike runner like me, if I suddenly go out and do a lot more activity, I might get Achilles tendonitis, because it's that sudden increase in the stress on the tissue that counts, not what you're habitually using. Another part in the Achilles, which this is a little nuanced, but the Achilles doesn't come straight down. It comes straight and it turns. And so where your ankle, when you run on soft ground, your heel actually rolls in much more than if you're on firm ground. And that rolling in also creates extra stress on the Achilles. Again, if you're used to it, that's okay. But it is something people go, oh, I'm going down, I'm going to be on vacation, I'm going to go to the beach, I'm going to run on the sand because it's so beautiful and so soft. But running on the sand is actually very stressful on certain parts of your body. And shin splints is one, and the Achilles is another. And so now, what exercises can you do? We're going to get in, or warm-ups. Well, you want to, with any warm-up, you want to warm up the part of your body. So you would walk before you take a walk, and then walk fast, jog before you start to run faster. It's just a general warm-up. We're going to get into more specific exercises in the next part of the course and the rehab. But it's really simple conceptually. You take the activity that hurts, that caused the damage, and you want to do that activity. But you want to do it at an intensity that your body can absorb. So in the example of the Achilles, it was going up and down on your toes, right? Toe running is the problem. So now what we want to do is create that same stress, but something that you can absorb. Now, if you have a really, let's assume you don't have a really bad Achilles and you can walk without pain. So now I'm going to have Alex come back here. Okay, so the problem is he's got Achilles tendonitis, and it hurts him to go up and down on his toe. Now I'm going to have you do one leg. Just lift this leg up, and now go up and down on your toes and down. And see, look at the grimace. No, you can't see the grimace, and he's faking it anyway. So, okay, so that hurts. So he can't lift his body weight up and down. Now it turns out in tendinopathies and in many muscle strains, we want to do what's called negative exercise or eccentric activity. And that's simply put, if I take this bag and I bring it up, that is my muscle's getting shorter as it's working. And if I let it down slowly, I can feel that muscle even though it's getting longer. That's called negative exercise or eccentric activity. For tendons, eccentric activity seems to be the key. Now, if we have Alex just go up and down, it hurts him too much, and we want to get that eccentric activity. So I'm going to ask Alex is to put your foot down, sorry. Okay, I want you to go up on both legs, lift your good leg, and now down on the bad leg. So now what we've done is we reduced the weight on the good leg, and again. There you go, and down. Show his feet again. He learned this really quick. Wow. And down. Okay? Now, we would modify this a bit. He's holding it a little bit too long, so if I do it, look at me here, it's up on two and down. Up on two and down. So I'm not holding it up there. It's just coming down in a nice, slow way. That's the first step. Thanks, Alex. There's... what we've done there is we use the good leg to reduce the stress for the bad leg so that now he can actually maybe do that. Maybe he can do 3 sets of 5, and that's about all he can do. With time, he would build up to 3 sets of 6 or 8 or 10. And the 3 sets, and these are all recipes, and different people will do different things and different types of injuries. Sometimes we'll use 2 sets of 30, which is with a short rest, which is an endurance program. And sometimes we'll use, much higher weights or do things in rapid movements. And so it depends on the particular injury. In the Achilles, let's say Alex was so sore that he couldn't actually even let himself down. I've had patients like that as well. Well, we can do something different. You could go into a gym and you could put your feet against one of these leg presses. So leg press is normally something, pretend this is my feet, where you have your feet on a platform and you let the platform come back, you bend your knees and you push again. So it's normally of that sort. But you can do the same thing by putting your feet on the platform and pushing the platform down like that. So now you could put the weight up there with both legs. Then you take one foot off, and then you push down, and then you let it back. You push down with both and let it back. Now, Alex might weigh 180 pounds. We don't have to put 180 pounds on that platform. We could put 50 pounds on that platform. So now we can train that Achilles with any weight that we want. We're not bound by his body weight. Another way you can do body weight, get away from body weight, is if you do it seated. Now the Achilles has, your calf muscle is made up of one that attaches above the knee and below the knee, and so we actually usually do both of them, but we can do that Achilles strengthening in a seated position in order to get some benefit. You can do it with elastics. So I have my foot up here and I can hold an elastic and kind of push my toes down, holding the elastic. The problem with the elastic is I don't actually know how hard I'm pushing. And so I don't get the feedback whether I'm getting stronger. And one of the really important principles of rehab is about getting the feedback for the objective. If I think that the problem is that you being stronger will cure you, then I should be measuring your change in strength. And if you're using free weights or even in your body weight, how many times you could do it, then I know you're getting stronger. And if you're getting stronger and your pain's not changing, then my whole idea of what's benefiting you might not be correct. There might be thresholds, and sometimes you're just not strong enough. So it's not an all or none again. But we should, every time you have an injury and you're doing something for the injury, anytime you're doing anything in life, you should have objectives, and you should periodically reevaluate and make sure that you are achieving those objectives. And so if you're achieving the strength, but the pain's not changing, the treatment should change. Something else is off. The other part that we do, Alex, you could see here, was doing the strength training on the floor. And I just showed you, if you were hiking up a mountain, you would have to have the ankle bent at a much greater angle. And so if your sport was hiking, your activity was hiking, we would still have to train it that way. And even if it's not, we can increase the stress after you get up to your, whatever, it's 2 sets of 30 or 3 sets of 10 or whatever you're going to do. On the ground, we can now do it over a stair. So here, if you think, here's, if I'm not on the stair, I'm down here and I stop. If I go over a stair, I can go below. So now I'm putting a greater stress on that Achilles tendon in the back. And so we can use all of the principles that we've been talking about, which is, and these are matters of intensity in terms of whether you're working it on the stretch or not.
You talked about how cold muscles absorb more shock than warmer ones. Which type generates more force and speed? Would it be the warmer muscles because they are less stiff?
So a warmer, absolutely, a colder muscle absorbs more stress. And it's not that I wanted to tell you that you should be exercising with cold muscles to prevent injury. That wasn't the idea. The idea there was just more to deal with the concepts of injury and stretching and how we're working through things. A warmer muscle, and when we say warmer, we don't mean, it's not necessarily the temperature. So we have to be careful. When we exercise, the temperature muscle warms up. But we can also warm up the muscle with heating pads. Now that warmth doesn't penetrate that much. We can get deep tissue warming with particular machines. If we're talking about performance, the temperature has some effect. The enzymes to break down oxygen are more effective at a slightly higher temperature. Your muscles, the enzymes to create the force, the way the muscle contracts, is more effective at a higher temperature within reason, within what our bodies normally are. They go too high, the enzymes die. But warm-up does a lot more than just increase the temperature. The temperature increase is a byproduct. The warm-up, what it's doing is the cell is synthesizing new enzymes, new molecules to help consume the oxygen, to break new enzymes, to break down more glycogen, more enzymes to convert the glycogen to pyruvate and to go into the Krebs cycle, and more enzymes to use the stuff that's coming out of the Krebs cycle, that NADH2, and and oxygen, in order to generate ATP. It's that part of the warm-up that is most important. The temperature adds to that. So we use the term warm-up, and it's maybe a little bit confusing because people are thinking about it in terms of temperature. But absolutely, when your muscles are warm because you've been using them, active warm-up, if you wish, is super important for performance. And I have to say, off the top of my head, I just can't think of an activity that you would not want to warm up for. It would benefit any type of performance. Now, if any of you have an idea where there's a performance where it wouldn't benefit, let's throw it into the discussion group because I'm just thinking off the top of my head.
Okay, there's one that just came in. A student's asking about the RICE method of treatment to heal an injury versus the HEM method, heat, exercise, and massage. So the student has heard that the HEM method is better, but do you have any thoughts on which might be best?
I never heard the acronym HEM. I don't know why those are separate. To me, they're like, there's no reason why you would do one versus the other. So let's just go what RICE is. So RICE is rest, ice, compression, and elevation. And some people will throw in a P before that, price, for protection. Protect the area, rest it, ice it, compression, and elevation. That acronym, or those methods, are for acute injuries. You turn your ankle and you sprain it. What should you do immediately? Well, it hurts to walk. Don't walk on it. You know, if I bang into a wall, well, you got to protect it from banging into a wall. We want to decrease the swelling, so we're going to ice it to decrease swelling. What ice does is it makes the area cold and constricts the blood vessels. If there's less blood flow, there's going to be less swelling. This isn't completely true, but this is what everybody says. Heat increases blood flow, and if you increase the blood flow, you're going to increase swelling. That part is actually true. And elevation is if you lift something up, then the water in your body follows gravity. If I take a glass of water and I turn it upside down, the water falls to the ground. If I have swelling in my ankle and I leave it down and I leave it hanging over a chair, then that fluid is going to drain into the foot. And my whole foot will become swollen. If I lift it up, the fluid drains back into my calf and gets reabsorbed. So this is for an acute injury. If you have a tendinitis, we don't talk about compression and elevation. We will talk about ice to try and decrease inflammation and minimize the swelling. And we might talk about protection, putting in a heel lift. So that's for acute. The Price method is not about rehabbing an injury. And we'll talk about rehabbing the injury again in the next few lessons. So let's leave out the heat part and just talk about exercise and massage. With every injury, you protect it with muscle spasms. So you're going to lose some range of motion. We have to regain that. And you're going to get weakness. So we have to strengthen it. And you're going to lose some what we call position balance sense. We'll talk about later. You have to regain that. That's all exercises. That's the only thing that can restore those features. Massage is a little bit different, and I'm going to use the term manual therapy instead of massage. There are many different forms of massage, and massage generally is thought about the muscles. But you can use massage on connective tissue, on your ligaments. So something called transverse friction. And some of you may have heard of ART, which is also a type of massage to break down scar tissue and functional levels, and different people have different philosophies and theories. But then there's also manual therapy. And some massage therapists do this. A lot of chiropractors do manipulations and mobilizations, and a lot of physical therapists are trained manual therapists, and there are osteopaths and athletic therapists and athletic trainers who can also do it. And in some jurisdictions, there are legal battles where people are saying, no, I know better than you, and we should be able to, my profession should do it, not yours. But let's talk about what it is. So we'll use Jasmine because it's easier usually on this, but did I do this to you last year? No? Okay. So here we have Jasmine, and she can move her wrist. Oh, we got to turn you sideways. You can move your wrist like this and like this. Okay, now relax. Relax. Okay, I don't know if we can we see that on camera? It feels weird.
Yeah.
You're not seeing her face, but.
I have no bracelets on this arm. It's easy.
Yeah, but it's harder for me because I can't get my arms in that way. Oh, can you try the camera here? So, relax. Oh, now she's nervous. Okay, okay. Can you see that?
Yeah.
Alex goes, that's disgusting. Can we try and get that camera in? Relax, relax.
I know. It just
Relax.
feels really weird.
Okay. There. Can you see that?
Ugh.
Can you see that over here? Watch here.
Yeah.
Okay. Her bones are going up and down. Okay. I hope you can see that. I'll try and explain it this way. These are two bones sitting here. And what's happening when you move, you rotate like that. Okay? And there's a little bit of motion. What I was doing was this. And that we call mobility of the joint. And it can go this way as well. And it is super, Jasmine's wrist never does that. And she's like all worried. That's normal. It's important that happen. All right? And if her wrist had a lot of scar tissue, it wouldn't be able to do that. And because it wouldn't be able to do that, it would no longer rotate properly. And she would have restricted motion and she would have pain. And she could try and do this, but it just wouldn't be the same as having that extra motion and mobility. Now, how do you regain that mobility? You can do that by simply taking someone who's got a stiff wrist and doing these mobilizations, or you can do it quickly as a manipulation. And different people will argue, well, in this particular case, it should be manipulated, and that one, it should be mobilized, and some people feel more comfortable with another. And we don't want to get into that, but that's also manual therapy. So we have the ART and the transverse fiction, we have massage muscle, we have, so all of these are manual therapy. And manual therapy is an important part, or can be an important part. But from my perspective, the manual therapy doesn't correct an underlying weakness. It doesn't correct deficiencies in balance, and it doesn't correct a lack of range of motion in general, though I just told you it would improve range of motion in some cases. So it's a combination of all of them. Sometimes a manipulation is all you need, just one or two. And sometimes all you need is exercises, and the manual therapy doesn't help. And the art of the medicine and the therapy is trying to figure out what is the best for each particular patient that you see, because everybody comes in with their own unique features. And we tend to use similar things across a wide range of people. We reevaluate over 3 to 4 treatments, make sure that it's getting better, and if it's not, then we should change the treatment. Maybe change the way, if it's the exercises, maybe the way you're doing the exercises or not, or maybe the way I'm teaching the exercises. But you should not be going to therapy for 3 months, doing the same thing and not seeing improvement and nothing's changing. That is not appropriate therapy. You shouldn't be going for 3 weeks, nothing changing. It should always be short-term and long-term goals, and we see where we go.
Do we have time for another one?
It's almost 2:30. Right?
Almost
28.
2:30. We were stopping at an hour, or we were doing?
Well, I don't know. Does it automatically stop?
It won't necessarily automatically stop. I mean,
But it was scheduled for an hour. I couldn't remember if we were
I
what we were.
believe we scheduled it for 1 hour.
Okay, so well, let's do one more. And is there anything burning there that you?
There's one that I think Alex was going to answer about the different effects of doing cardio workout
yes.
before or after weights.
Oh, don't let that be lots of questions. I'll
No?
answer it on this.
Okay, so
Okay.
I do want to mention the question for everybody. Somebody was asking about whether if you do cardio before the weights or the weights before the cardio, is there a difference in the effects? And I think I may have even answered somebody saying that I have no idea of any of the research. And so I was talking about it here and saying, oh, that one I just don't know. And then Alex started to talk about some of the stuff that he's read. So he's going to answer that. I just don't know. On a theoretical basis, I don't see why there would be much of a difference. I could make something up. And I think I made something up. I said I made something up before in terms of the stimulus to the muscle. So I do want to, I don't know what Alex says there's no difference, and he'll go into some of the studies and how and why, and maybe in elite performance. But the idea is that the muscle is going to respond to a particular stimulus to adapt in a certain way. If I expose the muscle to a program that creates an endurance effect, like running a marathon, and I expose it to a program to gain high intensity, so two opposite spectrums, one to become a marathoner, the other to become a weightlifter, how does the muscle adapt? What's it going to respond to? Does it respond to the first one or the second one? My guess is that it would probably respond to the second one. But Alex says that they've done these experiments and it doesn't matter.
They're mostly inconclusive.
Mostly inconclusive. So it may be, again, it may be that it does some things in one person and other things in another, and it may be that they didn't take these very two extremes and test the extremes. I don't know the studies. But that's a fascinating question.
Simple answer is whatever works for you.
Whatever works for you, whatever is achieving your objective. Try it one way, you like it, try it another way. Yeah, absolutely. That's the simple, that's the best, and it's uniform across the board. Try it several times one way, try it several times the other way, and if you find it is consistently working better for you, then go with that. Okay, we have one more?
Sure. I'm planning on running my first marathon. How shall I prepare, and what care do I have to take care of my knees?
Planning a marathon, and what should I care? One, good luck. I haven't run a marathon. I did want to, but then I learned that it's not that good for you. So, so elite sports is the one thing we talked about. Sport. Elite sports is not damage. Elite sports is important for some people psychologically and helps us. We watch TV and watch all these amazing things that the body can do. But you know, injuries occur in elite athletes all the time. So there are benefits and risks to the levels of activity, and as we go into the more extreme sports, our risks of injury are greater. And so if you are training for marathon, your risk of an injury is greater than if you're only trying to run 10K. So how should you train? Same principles. Start easy, progress slowly, right? If you're getting pain, you got to back off. There are lots of different training programs, and the key is always about this gradual progression. The one that I guess I can give one plug. The one that I like when I look at is from the Running Room, which is a shoe store in Canada. I don't know if they're in the U.S. And so the guy who started that store, he's just got really nicely set out programs. But of course, if you're starting to feel pain, you have to back off. It's not set in stone. Somebody had a question about one method on the discussion that I had not heard about, two runners, and they had a program. You can look in the discussion post. I can't remember what the HEM program, I think. I can't remember what the acronym was. And that also looked like a good program. Their program, interesting for the marathons, was that they never had you train in marathon distance. So the longest run, I think, if I remember, was 16 miles. And that sounds reasonable. There's no reason that you actually, I mean, I agree with them. There's no reason that you have to train at the marathon distance in order to be able to run a marathon once. You just have to be able to train your body to absorb that capacity. Now, personally, I probably would try and do a long, slow run, maybe 16, 20. I don't know because I don't train, but you'd want to be able to have the psychological framework to know that you could do it when you go for the race. But once you've done one, then you no longer have to worry about that because psychologically you can know you can do it. I think if I had never run a marathon, and I was only, so a marathon is 42K. How much is that? Was the one, yeah, Hansen's method. So for what's a marathon? 26 miles? 24 miles? 26 miles. So 26 miles. If I only trained 16 miles and I had never run 26, psychologically, I might be worried during the marathon and I might end up giving up because I had never done it before. So, but once I had done it, I would psychologically be ready. And so I think the training. The guy who broke the 4-minute mile, and now I'm blanking, that's embarrassing, never trained at the speed, never trained running his mile. He always trained at shorter distances. And so this concept of training at shorter distances in order to run long distance faster is not new. It's old. But at the same point, we have all of these different components that you have to play with: psychological, physical, the training route, and all of that. So I hope that helps. As you see, I don't have all the answers. And everything that we've talked about here and in this course, when I talk about, and we talked about the research evidence, and I want to emphasize that again, these are my interpretations of the literature. I obviously believe in what I say. But I have colleagues who are very smart, who we have differences of opinion. And I want you to, as Alex just said, at the same time, take what works. What we talk about is what works for most people. Take what works for most people, see if it works for you. If it's not working for you, maybe you're applying it wrong, differently than it should be. Maybe it's just not the right thing for you. Anyway, we look forward to seeing you next week. Is our music week, I believe, right? Yes.
It's our arts, yes.
Our arts week, and that is, you'll get to see Frank in front of the camera at the screenside chat. And it's a fascinating, you'll see Isabel, who's a physiotherapist specializing in music injuries, and Bernard Pizio, who's a vice president at Cirque du Soleil, and Michael Montenero, who is chair of a dance, contemporary dance at Concordia University, and was also a choreographer for Cirque du Soleil show. Fascinating stories. I hope to see you there, and you'll also see how I've been coming along in my stretching, which I do every day now, at least for the last week, and for the next week until I can prove to you that it does work. Thanks a lot.